Hi guys, here's how to administer a medication through a PICC line or a peripherally inserted central catheter. So the important thing to remember is that any medication, no matter how many milliliters it is, you're giving it through a 10 ml syringe. So I'm gonna pretend that this is the medication I'm giving. We're gonna say that we have to drop 5 milliliters of said medication. So what I need to administer this dosing is 2 10 ml flushes of saline, because you're gonna flush before and after. You need another 10 ml syringe to drop the medication, and either a blunt needle or a real needle to drop the medication, and your alcohol pads. So first I'm gonna drop the medication. So I'm gonna put on my gloves, wash my hands first, put on my gloves. Take the cap off the medication, do your 3 writes of medication, make sure it's right. Then I'm gonna assemble my needle first. And even though this was just open, you still wanna wash it with an alcohol swab, just in case, for the whole 15 seconds. And then I'm going to draw back 5 milliliters of air. Right. Okay. And then since I'm using a needle, because there was no bunts in here, I'm just gonna deploy the safety on the bed. So I'm gonna uncap this needle and disregard it, but you would want to label this, put another cap on this, and label this, because all of these look the same, so you don't want to give the wrong thing. Then I'm going to go over to my patient. I'm going to obviously do my last check of the medication, and then first scrub the hub, 15 seconds, and then do saline first. So I'm using the 10 mLs of the saline, and I'm doing the push-pause method, but first I'm gonna draw back for blood return, make sure it's in the right place, push-pause method, make sure the line's patent if you didn't already check for patency, push-pause, 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 push-pause. Next, I'm gonna scrub the hub again. And then administer my labeled medication. Still same thing, push-pause method. Sometimes medications, you have to give them over a certain amount of time. You can't just slam them in, so make sure you check with the drug book, and if you're giving multiple medications, ensure that they are compatible to be given through the same line. My push-pause method. And then one more scrub. And then this last flush, you want to push it at the same rate as you would give the medication. So pretend you're giving Zofran, that you're supposed to give over at least 2 minutes. So you would also give this 10 milliliters of saline over those 2 minutes. So just make sure you check the drug book to make sure you know how long to administer over. And if there is conflicting, it's always better to give it over a longer period of time. So doing that push-pause method. And then disregard all of your stuff and wash your hands. And that's it.